Hi everyone, today I passed PCCN exam. I did not care how much I got it, but I passed. But I thought about my coworkers. I made this video for you guys to make like a last minute study. Like you really don't have to study a lot, but make sure that you review cardiology, very important, in and out. You don't really need to study much. Cardiology and basic of pulmonary, especially blood gas. Okay, as soon as you arrive the testing center, they sit you down on the seats to take the test and give you a scrap paper and pencil. As soon as you start hitting the button to start your test, write this down on your scrap paper that they provided. Here is some things that I made. My video thing is really, I don't know if you guys can see it. This is blood gas, how to interpret blood gas, and also EKG interpretation, like when you have lead 1, 2, 3 and all that, how to interpret. And electrolytes, make sure you learn mag, phosphate, potassium, sodium, calcium. There was at least 2-3 questions on calcium. Must know systolic versus diastolic heart failure and treatment, drug of choices. Because systolic, you have a problem with the contraction problem, and diastolic, you have a filling problem. How do you treat that? Very important. These are a lot of questions that came, especially gas and MI. You have to know on the test. For you to know more about it, this is called blood gas tic-tac-toe. If you go to YouTube called ABG made EC tic-tac-toe method, you will see how to interpret blood gas. If you go to YouTube 12 lead EKG interpretation practice videos, I'll show you how to interpret EKGs. Here I have this little EC, made it easier. So as soon as you arrive, put this down on your little paper so you remember. This is lead 1. So if you have an inferior wall MI, you see this little, it's I. You see the little I that I draw? This is I. Lateral, it means 1, AVL, and V6 and V5. You see the L that I draw around it? And also V1 and V2 is S, septal. So if you write this thing, it's easier for you to remember. Inferior, lateral, septal, anterior. If you look at this video, it makes it easy for you to understand it. I will further post more stuff for you to remember, okay?